Joining me now to talk more about this is Dr. Matt Shoemaker, Division Director of the Infectious Disease Department at the University of Kansas Health System. Dr. Shoemaker, thank you so much. Dr. Shoemaker, in your opinion, I want to talk about Kelly's report there. In your opinion, are weight loss drugs worth it?
I guess I would have to come at that from an infectious disease standpoint, since that's what I do day in and day out. If you're looking at it from controlling diabetes, I think it's probably worth it. You know, we know long-term effects of diabetes reduce people's quality of life as well as their life expectancy. And those patients with uncontrolled diabetes have increased risk of infection. Now, based on what Kelly reported with regards to weight loss, I think this is something that we probably need to think about putting a pause on and maybe getting more data from some robust randomized clinical trials.
As Kelly also reported, officials in the European Union are looking into claims that Ozempic can increase suicidal thoughts in patients. And what do you say to patients on the fence about this treatment? Should they wait until more research is done, like you just suggested?
Yeah, I think they should wait until some more research is done and have, you know, a candid conversation with their healthcare provider, especially if they have any underlying mental illness or family history of mental illness, because we know in the United States, you know, mental illness is a large problem that we're trying to tackle.
Dr. Shoemaker, another topic that seems to really be hitting Americans hard is the use of opioids. A majority of drug overdose deaths involve opioids, but a new study shows that treatments remain significantly underused. And the CDC says that more than 80,000 people died from an opioid overdose in 2021. However, according to research published in the Journal of American Medicine, a network that only about 1 in 5 adults receive medications to treat opioid use. Now, various drugs have been approved by the FDA to treat the condition, but what is the disconnect that people are still craving these drugs but aren't actually getting them and following through with treatment?
I think there are a couple things that limits people's ability to access these medications. You know, one is where you live. There are only about 2,000 treatment centers in the United States. Most of those are situated in large metropolitan areas because they have, you know, more patients that they can take care of, which is good. The downside is if you live in a rural area, you may have to drive a couple hours to get there. And for a lot of these medications, you need to take them every day. There are federal regulations regarding how they can be dispensed. They have to be dispensed in a licensed accredited opioid treatment center. And the patient has to be supervised taking the medication. So for somebody that lives 100 or more miles away, the logistics and the cost of being able to get there for the medication are just something they can't overcome.
Dr. Shoemaker, I had no idea that that was also a variable until you just told me that, and it totally makes sense. If I'm living in a rural community, it can be difficult for me to get access to the medication, and I had no idea it had to be supervised in order to take it. So how can people advocate for doctors to prescribe more of these treatments if they don't have facilities near where they live?
I think, you know, this is something that's being discussed in Washington, D.C. Right now in Congress. I think some of the legislation has been stalled, but I think, you know, patients can advocate for themselves by reaching out to their local congressperson and making sure that they're aware of the problem.
Dr. Shoemaker, thank you so much for joining us.
The other thing, you know, from my standpoint is...
No, go ahead, finish that. I'm sorry, we had a little bit of a delay. What were you saying? From an infectious disease standpoint, you know, one of the leading infections transmitted through injection drug use is hepatitis C. Additionally, we do see hepatitis B as well as HIV. If we can get patients on these medicines and get them off of the opioids, particularly in the setting where they're injecting them, we can decrease the risk of these infections being transmitted.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.